I've heard stories of people on a certain healthcare insurance, Medicare plan, that have to wait 30 days.
Yeah.
And I don't know how they do that because our rules and regulations require us to get out there within 48 hours.
Is Medicare free?
If you have 10 years of working history, paying into the system and taxes, right, like all of us are, the Part A is free. The government is, and again, don't quote me on this, right, but this
You're just on being recorded on
A podcast.
Okay, yeah, I guess I am being quoted.
Preston, thanks for being here, man. Welcome back to the Happy Caregiver Podcast, everybody. Today, we're diving into a topic that I don't think is very well understood. It sounds and it feels very intimidating, but we have the best person possible here to explain and try to debunk all these myths, educate everybody. And the topic is insurance, Medicare, Medicare Advantage, all these different things. So, Preston Henry, thanks for being here.
Yeah, absolutely. No, I'm excited to be here. Appreciate you allowing me to come.
Was it a drive? Where are you coming from?
No, just Saratoga Springs, so about 35 minutes or so.
Not bad.
So
Good.
Not too bad.
Good.
And a good time too. With traffic, it's usually about an hour. So anyway, good time.
Yeah.
Well, good. So we have Preston Henry here, and he's the CEO and founder of Henry Insurance Company. And he's been working with Medicare for 10 years, helping thousands of clients and leads his team of agents. So you have multiple people working for you?
I do. I have 8 agents that I work with. Part of my agency. It's kind of interesting though. They have their own companies. I'm not their boss per se or anything like that.
But you're all affiliated?
Yeah, we're all affiliated, and I help them with recruiting, with training, with selling, all the above.
Well, that's awesome. Why don't you tell us a little bit more about your company?
Yeah, so again, started it 2.5 years ago, Henry Insurance Group. It's been a fantastic ride this entire time. I wasn't expecting to have an agency, to be honest. When I broke away from United Healthcare 3 years ago, I had planned on just being on my own for about 5 years, 3 to 5 years, and then maybe looking into having my own agency and growing a downline. And things just kind of fell in my lap, to be honest. I started having agents reach out to me from who I had known over the past 10 years and found out I started my own agency. And obviously we had a good relationship and wanted to join my team. And so quickly created a team about 6 months into it.
That's exciting. Good for you.
Yeah.
Nice.
Yeah, it's been great.
So this podcast, it's really for anybody taking care of mom and dad, or potentially somebody who's signing up for Medicare. They're around that age, 65, right? That's the kind of golden age where, is there a registration process? Does Medicare reach out to you? How does that work? Because our demographic, or like who's listening, they're either, like I said, taking care of mom and dad who they've had Medicare for a long time and they're wondering, are there benefits that I'm missing? Is there a Medicare Advantage plan that I should take? Or what I see happening a lot, people electing for a Medicare Advantage plan and shoving aside their traditional Medicare because it's cheaper, but then they don't have the benefits that they need. So those are the things I want to talk about today. But just for you to sort of understand who we're talking to, potentially some of your future clients, but also those who, existing patients that have it and want to understand how to properly use it, or if they're registering, some of those questions. But I think in this realm, it's, as a provider, what's the best plan for people? And I know it's different based on what benefits they're going to need.
For sure.
But I think that what I'd like to get to today is traditional Medicare the best? Does it trump everything for somebody who's looking to use home health and hospice? And anybody who maybe isn't looking for home health and hospice now, is there something better? And how does that correlate? I don't know if that makes sense, but It seems like some insurance plans are better for people who need in-home health care. And if you're healthier, maybe there's something different. So I think those are some of the, obviously I'm confused. I think other people might be confused about it. And I've been in healthcare for 20 something years. Yeah. And it's, for us, we're like, hey, Medicare is really great for what we do.
It's really confusing.
But I know, I've got a buddy, Dr. Joyle, he's a pain doc, and he's like, Medicare is not great for the people that come to see me. So those are some of the questions we have for you, and I think other people have as well.
For sure.
Well, I think we should start in the beginning, and that's understanding what the Medicare benefits are. You got Part A, Part B, Part C, Part D. What is all of that?
Yeah, so to keep it pretty simple, right, you have Part A, which is hospital coverage. You have Part B, which is doctor or medical coverage. Part D is drug coverage. And Part C is kind of like a combo of the three. So not to go into too much geometry, but A plus B plus D equals C, right? So C is a combo of all of them and is called Medicare Advantage. But yeah, a lot of concepts that you'd mentioned, you know, that I'd love to go through in detail one-on-one. But yeah, that's kind of it in regards to Medicare, Part A, B, C, D.
Well, let's get into A, B, C, and D. But first, here's a question. Is Medicare free?
No. So, well, Medicare Part A, if you have 10 years of working history, paying into the system and taxes, right, like all of us are, the Part A is free. But Medicare consists of more than just Part A. It also has the Part B, which does have a monthly premium. Right now, it's $174 and some change. Next year, it's going up to $185.
Is that a month or is that a year?
Per month.
Okay.
So it's a monthly premium, and it can fluctuate depending on your income. So if you make more income, right, significantly more, that premium can go up. But for the majority of Americans, it's going to be that $174 this year and $185 next year.
So this is that little line item in your check that we've all been,
Yes.
you know, we just love it when it comes out, but it really is useful down the road, right? We're sort of prepaying for a lot of this care, which is why I think Chris and I are so, we want people to take advantage of it, right? You have it. This is a benefit. Home Health and Hospice is covered 100% by Medicare. So when people are reluctant to bring these services home to mom or dad or themselves, we're always like, well, you've been paying for this service, this help, this extra care that's available for 10, 20, 30 years. This is the actual time to use it. Yeah.
The golden years.
You don't get to take it with you.
Yeah.
So it's not free, $174 a month going up next year.
There are also deductibles that apply if you just have straight Medicare. So if you just have straight Medicare, there are deductibles for Part A. It's typically an 80-20 plan. So Medicare typically pays 80%, and then you're responsible for that 20% co-insurance. And that's just straight Medicare, traditional Medicare. With one other thing to keep in mind that's important to know is if you just have straight Medicare, and this is what I would say is the biggest reason why I would recommend maybe looking into a Medicare Advantage or a supplement plan.
It used to be Medicare Gap.
Well, yeah, Medicare Gap. So a supplement, Medigap, same thing, right?
Okay.
So there's no ceiling in regards to cost, the amount of cost that you could accrue in a given year from January to December. So when you're responsible for 20% and we don't know what that 20% is, that's how you get in trouble, right? You got to have something in place, a safety net, if you will, to prevent something catastrophic from happening and bankrupting you, essentially.
Right. You've got that Medicare person that goes to the hospital frequently. They are saddled with that 20% for their frequent flying.
Yes. Yep.
So what's the solution for that?
The solution is you have two options. You have Medicare Advantage or you have Supplement. And the difference between the two, you have Medicare Supplement will start there because that keeps your traditional Medicare the same. So you have traditional Medicare as your primary insurance, that red, white, and blue card. And then you can get a supplement, and there's a bunch of different supplement plans to choose from. If it were me, I always recommend, for the most part, the Plan G. Plan G is going to give you the entire coverage for the 20% that's left over, with exception of a $240 deductible for Part B, which is the doctor coverage. But outside of that deductible, you typically have 100% coverage, and you don't have any copays throughout the year. You just have that monthly premium for the Part B and the supplement side.
Okay, so let's break this down. So for everybody that's watching, Part A has $174 monthly.
Part B.
Oh, Part B, excuse me.
Yep.
Part B has $174 premium every month.
Yep.
Or excuse me, the just the fee, right?
Yep.
And then you're recommending, in addition to Part B, Part G, which has a monthly fee of?
That can fluctuate.
Okay, so that fluctuates.
Definitely
but
fluctuates.
But it covers the 20% gap
Correct.
that you're incurring by using Part B.
That's
okay.
right. Yep.
And you said it was 200
and Part A. It's Part A and
depending on which one you have. Right.
Yeah.
Okay. So you can have G This is like alphabet soup. You can have part A, B, C, and D, and G will still cover your 20%, right?
So actually, no, you can't have part C and a supplement at the same time. It's either one or the other.
Okay, so your C is the
Advantage plan.
But you still have 20% on the line.
You do have set copays typically. There is 20% for certain services like chemotherapy, radiation, durable medical equipment services like oxygen and things can be 20%. But for the most part, most Advantage plans are going to have a set copay, which is nice because now you know what the cost is going to be. Now you know when you're electing
that sort of a cost.
Yeah.
So if you have anything but C and you elect for G, that $240 copay.
Deductible Part B.
Yeah, and I'm really bad at insurance things. But is that per incident or is that annually?
So that's annually.
That's not terrible.
Yeah,
that's a good solution.
Correct. And let me just say, because you've mentioned it a couple times with the complexities of Medicare, I appreciate them because it gives me a job.
Sure. Right? Yeah. We're definitely going to be putting your number on the website because it is confusing, but also it's figure outable, it's understandable, and it's nice to have people like you. I've been doing this for a long time. Chris has been doing this for a long time. And I still see people in their 80s, 90s who have been using this benefit for a long time. They're either paying a ton for coverage that's not right for them, or they're paying very little in a monthly because that feels good. But when it comes time to use it, they're either out of pocket or
there's no services available to them.
Yeah.
Right.
Correct.
So what's the best way to navigate it? You know, if I'm taking care of my mom, who's not quite old enough for this yet, but she will be soon enough, right?
Sure.
What's the best way for me to tailor a plan for her?
So going back into the differences between supplement and Advantage. So supplement plans, the pros to supplements are definitely that there are no networks, right? You can go to any doctor you want nationwide. If they accept Medicare, they accept your supplement, right? So you can go to any doctor, which is very nice. It gives you that convenience factor. You know what your cost is every year because you're paying that monthly premium. And you know that you have that monthly premium plus the deductible that you have to pay out of pocket, right, potentially throughout the year. But once that's covered, you're covered 100%. You don't have to worry about whatever may come your way. You've got that coverage in place. And so that makes it very nice and convenient. But the downside to it, of course, is there's no dental benefit, there's no vision, there's no extra stuff, bells and whistles, if you will.
There's no gym membership.
Yes, there are gym memberships with certain supplements.
Sneakers.
Certain carriers will offer that. But for the most part, it's not going to cover those extras. Plus, on top of that, it can be pretty expensive. And the cost goes up every year. So every year that you're on it, typically the rates go up, and that can be a burden for a number of people. I work with a number of low-income demographic individuals. Has kind of been my specialty, serving the underserved demographic.
Nice.
It honestly makes me feel, that much better, going to work every day. But yeah, there's some pros and cons to that for sure. Advantage plans on the flip side, you have the zero premiums for most plans. And then it does offer the dental and the vision. But like you mentioned, what happens if I suddenly have to be in the hospital for a month, right? Well, you're going to have some higher
It seems like Advantage plans are for healthy people that won't use it. That's kind of what we say in the industry. It's like, well, if you're not well and you need the insurance, this isn't a great plan for you.
So I literally crunch the numbers, and this goes back to my accounting days, right? I crunch the numbers for every person that I sit with, and I try to give them a feel for which one makes the most sense. My preference for the most part, typically, is actually Advantage plans, even if you don't have a very good health history, because if you crunch the numbers and see what you're paying monthly for your supplement and any extras that you're paying for your dental and your vision that you don't have coverage for, 9 times out of 10, you're going to come out ahead on an Advantage plan, which is not what most home health companies want to hear, I would say.
Sure. It's just true.
Because it's easier. It's easier to obviously do that, navigate the numbers and things. Fewer authorizations typically with traditional Medicare, and they're easier to navigate. But the other flip side is those extras that come with Advantage plans.
Yeah, what's interesting, and I'll let Chris jump in on this one, but for Home Health and Hospice, those Advantage plans don't cover very many visits at all. So if they're homebound and truly need home health, and if they're, dealing with end of life, that's sort of a different conversation. But home health, why don't you, Chris, explain to those listening what the best insurance or the most value or benefit when mom or dad need home health with a traditional Medicare plan versus an Advantage plan?
That's a hard thing because we don't get reimbursed at a very good level. And so a traditional Medicare patient is entitled, and then they get some more services in the home that person that's on a Medicare Advantage plan wouldn't, just because of the reimbursement structure of that plan.
Authorizations.
The authorizations and as an agency trying to get authorizations from, United Healthcare, I can't get. And so that's really frustrating that they only have 4 providers along the Wasatch Front to serve over 70,000 people.
Yep.
4 home health providers.
I think this is a huge conversation because families and patients who need this care, mom and dad are homebound or they're homebound and they need home health. They surgery or they're just bedridden. It's that time to take advantage of this, this incredible healthcare that's available. I think this is like a conversation. Nobody's having this conversation. Just an open, honest conversation about, home health agencies saying, hey, we're only allowed to do this. We can't provide more care than your insurance allows us to. It's kickbacks, entitlements, it's enticement. And so it's not like we don't want to, and in a lot of cases are willing to provide care, let's say for free. Problem is our hands are tied.
Right.
We don't have authorization. We can't come out. We don't have a benefit to be able to, allow us to provide that. It's essentially just not allowed. I don't know if you call it illegal, but these are the conversations that I think are hard because we have so many people out here that bend over backwards to answer the phone within 3 rings, to make sure they're checking authorizations, to get doctor's notes, talking with family, coordinating the care. And then our hands are tied when the insurance company just doesn't give an authorization.
Mm-hmm. Let me just say, I completely agree with everything that you're saying, and I'm 100% behind that. There needs to be some significant changes on the Advantage plan side for sure, 100%. I love what you guys do. I've talked to many of your clients, and different consumers out there that have home health. It's a fantastic service that's being provided, and there needs to be more of that authorization. It shouldn't be so difficult to get things.
Well, even just having 4 providers.
Yeah, having a smaller, I would argue actually that a lot of the carriers, I'm not going to name one in particular, but a lot of the carriers don't have as large of a network as they should, as they need to have. It's just it's a tough industry, I would say, because I know that many carriers want to have more home health providers available, and I won't go into the weeds of it, but there's just some things that kind of make it difficult for them as well. But there needs to be a shift. There needs to be a difference.
I've heard stories of people on a certain healthcare insurance Medicare plan that have to wait 30 days.
Yeah.
And I don't know how they do that because our rules and regulations require us to get out there within 48 hours. And I have to live by that rule, and I don't understand this 30-day wait to get on services.
So it's moments like this where I wish I were a CEO of a big carrier, right? Where we could have these conversations and be like, okay, yeah, this needs to change. We need to make some changes, be a difference maker in the industry, right?
Right.
Shift things a different direction.
Right, because you can see how financially it makes sense to have these Medicare Advantage plans when you're healthy and you don't really need a lot, and you are going out with vision and dental, and it's really nice to have a great gym membership, and there's a lot of really great perks that come with that, and especially covering meds. Yeah. That's where a really big plus is. A lot of these Medicare Advantage plans cover meds that you would pay for on your Part D plan.
Much more expensive on standard Part D plans, much higher premium. So the other tough thing about supplement, right, is you have the high premium for a supplement plan, plus you have to pay separate for your drug plan, which is another premium.
Right.
Plus, if you want any dental, you have to pay a premium on top of that. I'm licensed to offer dental plans. I don't have one myself, and I would get paid for it. right? So I don't see the benefit really there. There's a lot of high premiums with those plans, and I'm one that has 7 crowns, and I've got 3 kids and using orthodontia services. You know, so
you've got miniman driving around to taking people to get braces. That's all you do.
So it's just there's a lot of extra cost with these supplements. And it hinders a lot of the demographic that I work with, right?
Right.
So it would be nice to have an Advantage plan for a set number of years and then transition over when we need, home health, for example, just flip it to a supplement, for example. The tough part about that, however, is if you don't get a supplement in the first 6 months of turning 65 of becoming eligible for Medicare, then you're subject to underwriting. And if I'm needing home health services, my underwriting is going to kill me there. Right? And so then the premiums jump up even higher to the point where it's just not, feasible. And so there isn't this perfect world of starting with an Advantage. Now, having said that, with certain home health companies, right? You mentioned the Care United Healthcare, however many they have, right? I still believe there is a place where the two can coexist, not to a perfect realm, right, where we would like it to be, but still in a place where, obviously you have certain carriers that work better with you and certain clients that you have. We can switch their plan or look into making plan changes every year and potentially moving them from one carrier to another that fits their ultimate needs, and that includes their home health.
Yeah. Well, and I just want to clarify, this episode is not about trying to indoctrinate people and saying, get on traditional Medicare because that's better for our business. This is a conversation to just benefit everybody to understand insurance, Medicare Advantage plans,
for sure,
and the like. So while we would love everybody to have traditional Medicare as a business, we'll just be honest, this really isn't about convincing them to do it. I think it's about understanding more about what you just said, the landscape in general. And then some of these things, like I had no idea that within the first 6 months, you have to elect for a supplemental plan, or else you have to undergo underwriting.
Yes, and
if you want that later.
First 6 months, you don't have to be. There's no underwriting involved. It's called guaranteed issue.
Wow.
Right, guarantee issue. So you can get on a supplement, at the very beginning, and it doesn't matter if you have cancer at the time, right? You can get on a supplement and get the lower rates.
What's the least expensive supplement plan? Like if somebody's like, well, it's like a life hack to be able to do this. Is there one that's like you'd like say, hey, get this one just so that you don't have to undergo underwriting later? Or are they all pretty pricey?
So if you switch from plan to plan with supplements too, you can be underwritten. So it's not even just choosing a supplement plan. They've
got this whole game figured out.
Yeah,
really right, good. They do. You're supposed to sit there when you're 65, you just retired, your whole life just changed. Get out your crystal ball.
Yeah.
And make a plan.
I'll share a quick story. So I was in Ogden once, golfing, and there was this he was at least, I think, 92, 93 years old, walking with his pull cart of golf clubs.
Wow.
Okay. And playing, half decent, and I'm like, how old are you? 92. I was like, oh my gosh, like that's insane, And anyway, throughout the round, because it was just us two playing, he asked me, what do you do for work? And I told him I do Medicare, and he's like, oh. And we started talking a little bit about the different options, and he's like, well, I've got a supplement plan. And I'm sitting here thinking, here you have this guy who's walking with his golf clubs, perfectly healthy, right, paying this supplement premium for 65 to 92 years old,
That's 30 years.
What are we
Just
doing?
Shy of 30 years.
Yeah, so he's a perfect dream scenario for, supplement carriers because he's been paying all these high premiums and never had really used any of it. Now, of course, we can't see what the future is going to hold. Are we going to be able to be in that great health for that amount of time? Who knows? But there's two sides of it. That's kind of tough.
So explain how you said something, and I want to make sure to capture it because this is also something we talk about with patients and families. When is the right time to switch? When can you switch? When something happens, are you stuck, or is there a time to have a consultation with you to say, hey, this is my situation now because the crystal ball wasn't working at 65. I was wrong.
Yeah.
This unexpected thing has happened, and now I need coverage.
Sure.
Are you stuck? And I know that there's open enrollment, but also is there life events that happen that trigger that? Or can somebody just call you and say, hey, I'm just feeling a little crazy and wild, I want to change up my Medicare plan?
Yeah. So we go back to one comment that you made at the very beginning of the show. You'd mentioned when can they become eligible, first of all, for Medicare? And that's typically when you're 65 years of age or above, or if you have a permanent disability and you're receiving Social Security disability income for at least 2 solid years, then you can automatically qualify for Medicare in that regard. So you have your initial enrollment period, which are those 2. And then you also have the annual enrollment period, which is what we're going through right now. So October 15th to December 7th. Every year you should be having a conversation with your broker and just going over, okay, this is how it went this year for me on this plan. Is this the best for me next year? Right? So October 15th to December 7th, you should be talking to your broker and just going over, because every year there's a lot of plan changes, a lot of things that happen year over year that you need to be aware of. Yes, carriers send you a annual notice of change document, but there's a lot more that goes on besides just that. And most people don't read their ANOCs anyway.
Yeah.
And so it's important to have a conversation with your broker during that time. If you have an Advantage plan, you also have the open enrollment period, which is January 1st to March 31st. Most people have no idea that even exists, right? So if you have an Advantage plan, not supplement, but if you have an Advantage plan, January 1st to March 31st, I like to call it the buyer's remorse period, right? Where someone signed them up over the phone, a telesales broker, right? Which way too much of that is going on, which is unfair to our seniors. But they make a change. Maybe they weren't even aware that they had made a change.
Right.
And now January 1st hits and I've got this weird plan that I wasn't even aware of having, or I've changed my mind, I don't want to have. Maybe I had a bad experience in January or February. You do have a one-time change that you can make to go back to supplement or another Advantage plan at that time as well. And on top of that, you have the special election period, which is what you just mentioned a minute ago. That could be life-changing events. If you qualify for Medicaid, if you lose your Medicaid, if you were working for an employer and you lose your employer coverage, if you move from one area to another, if you are admitted into a skilled nursing care facility, can create a special election period. So many different, they even have special election periods for declared disasters in Utah. So if the governor, says there's a declared emergency, in the state, that can open up a special election period. So lots of different options, but all the more reason to have a broker that you can reach out to who is knowledgeable about all those different things and can assist you in your navigation with that.
I'm happy that you exist. Tell me about changes, trends that are coming up. What's coming up for 2025? To be honest, I'm stealing some of Chris's questions, mostly because I think I'm way more confused about this stuff.
That's just fine, yeah.
But like all these questions are coming to mind, and I always just think like I'm probably like a lot of listeners where I understand it enough. I understood it with our billing team, but I just want to understand it. I feel like I'm the best example of a 6th grader when it comes to this stuff. And so you're saying it's always changing, which in my mind, I'm like, well, Medicare's just been Medicare for a long time and Advantage plans are kind of the same, but they're always changing. So is there anything coming up for 2025 that people need to be aware of?
Yes. So there's definitely a change with the coverage gap. So it used to be called the donut hole. That is no longer in existence next year. So there's a lot of complexities to that. Basically how it worked is you have your 4 stages for Part D for drug coverage. Your first stage is the deductible stage. This year and years prior, not a lot of carriers required deductibles, which of course you have to pay before your actual coverage kicks in. That's stage 1. Stage 2 is the coverage stage where you pay those copays, $0 for tier 1 or $10 for tier 2 and so forth. The stage 3 was the coverage gap or the donut hole. And that's where what you paid into the insurance and for the drugs, the coverage for your drugs, as well as what the insurance paid for the drug coverage, reached a certain amount, you would hit this gap,
right,
where you'd have to pay 25% for all of your drugs. And so your $47 copay drug might shift to $200, $250 a month for the rest of the year, starting in July, August, September, right? And so you would start out with lower copays, and then it would expand to higher copays for the remainder of the year. And you just keep paying that until you hit a catastrophic phase, which is the 4th stage of about $8,000. So that's a long time of what you've paid into it reaches $8,000. I don't know of anyone that's ever had that happen,
right,
per se, but it can be very expensive. So government stepped in and basically said, okay, we're going to put a cap of $2,000 on that. So $8,000 to $2,000, that's a huge savings gap for certain individuals. Well, what are the carriers going to do? Are they going to sit back and just eat that cost? Absolutely not, right? Now you have all these deductibles, right? So instead of having a $0 deductible for your drugs, now you have anywhere from $0 to $600+ for your deductible. So now you're paying more up front, and then you pay less once that deductible is hit for the remainder of the year, up to a $2,000 out-of-pocket maximum.
I mean, we've seen some patients with 30, 40 meds.
I have too.
And so, like, several $1,000s in copayments, I can see how you could hit that pretty darn quick.
No, for sure. And
Right.
so it is nice, especially for those individuals with a lot of medications. You have that $2,000 out-of-pocket maximum, and then you're done for the year. But for the majority of Americans, right, again, insurance is the healthy paying for the sick. Well, you're going to have the healthy that might have that one drug that's kind of expensive for them, and now they've got to hit that deductible.
Right. You can have a really healthy person that has osteoporosis that needs to have those injectables that can run very, very high.
Yeah. And so you have a lot more happening on the front end. Now, the deductibles typically apply for tiers 3, 4, and 5. So there's 5 different tiers of drugs typically, and tier 1 and tier 2. Drugs like your generic drugs are typically not going to be subject to that deductible. So not everyone's going to have to pay that deductible, but for those who have some expensive meds, they're definitely going to be paying a little bit higher cost, typically, depending on carrier for next year. Also, I like to share with everyone that the government is, and again, don't quote me on this, right? But this
You're saying recorded on a podcast.
Okay, I guess I am being quoted. Okay, but I've been told, right, and I've learned that the government is kind of, obviously during the COVID years, 2020 through 2023, there was this huge influx in money that was coming in for the carriers to help offset those higher costs, right? And now we've got this year and next year and the year after where they're kind of moving away from that, trying to get back down to a regular norm, okay? And so with that being said, the carriers are getting a little bit less funding or money from the government, and with less funding, you're going to have lower benefits and higher copays. And so
This sounds fun.
yes. And so that's just something to be aware of, because I have a lot of clients that are saying, well, why did my dental go down, or why did my vision, or why did my copays go up, right? That's part of the reason as to why is less funding is going to impact everyone.
We're also trying to get over the pandemic and the effects of it.
Yes.
It's a hard switch to go back
For sure.
after so many years.
And so this is kind of the reasoning, again, for our listeners, that's part of the reason why you're seeing most of the carriers scaling back in regards to their benefits or raising their copays.
Really, the goal is to be able to keep people out of the hospital.
For sure.
And how can these Medicare Advantage plans help these people stay at home? I see a lot more services being offered for the very healthy people to try and keep them in that space in their home. Would you agree with that statement?
Absolutely. So there are certain carriers that offer what's called value-based care. Now, traditional Medicare supplement plans, but just traditional Medicare, you have what's called a fee-for-service
Right.
model, okay? You go in, you see the doctor, they provide a service, you pay them a fee. That's the fee-for-service model, right? There are value-based care models that are being introduced to these Advantage plans where they are incentivizing the doctors to spend more money so that the doctor will pay the doctor more to spend more time with the patient. That's going to create better health outcomes for the majority of people. They get paid more to keep their patients out of the hospital, keep them out of the emergency room, right?
Right.
And so those are all different things that I think all carriers are going to implement. I've seen that with a number of them, not just the two in particular, but with the others that are trying to move to that model. And I think that's a good place to kind of answer that question, to hopefully benefit them and create better health outcomes.
Yeah, and that's what we've done here is we've created a system of care that helps keep our patients out of the hospital. That is our goal. And I tell my staff that all the time, that their job is to keep people out of the hospital.
That's the way to go.
People are happier at home.
That's why home health providers are an amazing contribution to this entire, health landscape.
I think we should do something fun.
Okay. I like fun.
Because, insurance is about the most fun topic I can think of.
Absolutely.
So let's have a little bit of
Preston's
fun.
been really fun to talk with.
Yeah, no, I think we're going to have you back a few times, because I've outed myself now on a podcast of how little I know about these things. And I was so confused for like the first 10 minutes. And I'm like, make this make sense to me. And you've done a great job of it.
Sure.
But it's always good, hopefully, you've had a good time so far. And we'll come back as these changes unfold for 2025. And I'm sure, people react to the episode and have more questions. We also want to make sure they can get a hold of you.
Sure.
So I want to make sure that we get to that. But first, you have your questions ready?
Yeah, I do.
So we're going to play a game. It's called Medicare Mythbusters, and it's sort of a quick fire. So we know the questions we're going to ask. We just did like a very simple answer.
Sure.
Okay, so like as fast as you can. Chris has the first one, so we're just going to go rapid fire.
Medicare is free.
No, definitely not.
You can sign up for Medicare anytime you want.
No, definitely not. There are certain times, definitely certain periods where you can enroll and can't.
Okay.
Medicare and Medicaid are the same things.
Definitely not. No,
Well,
Medicare is federal funded. Medicaid is state funded, and each state has their own Medicaid plans.
Medicaid covers everything 100%.
Medicaid or Medicare?
Medicare.
No, Medicare does not cover everything 100%.
Does Medicaid?
So Medicaid does not either. There are certain copays that Medicaid will have the person pay as well, but they'll be much less typically.
BYU or Utah?
BYU.
Hockey or basketball?
Sorry, I shouldn't have said BYU. I should have said Utah State.
I didn't give him the option.
You didn't give the right options there. All right, I have a question for you. What does it mean to be a happy caregiver to you?
Happy caregiver, making a difference in the lives that you serve every day, loving what you do, being happy, enjoying your, what you do every day, and making a difference in the lives that you touch. We talked off air a little bit about one of the number one things, that I learned, from my dad or from, growing up, and that was honesty. You've got to be honest. You've got to be transparent. You've got to work hard. You've got to answer your phone. You got to be there for your clients. I take every single person personally, every person that I meet with personal. I have a lot of clients that I've told them to just stay on the plan that they have now because that's truly what's the best option for them. And I still service them because they might have a broker that doesn't pick up their phone, or they might not have a broker or know who to talk to. And so being able to do that and provide that care really makes a difference for me and makes me happy with what I do every day.
I love it. I've noticed that about you. You see people for the humans that they are, and instead of an object to a means to an end.
Absolutely.
And I love that. That's really been really clear as we've talked today about how you really value those people that you serve.
Well, my tagline for Henry Insurance Group is "Welcome to the family." It really, in my 10 years of doing this, one thing which is unique about me too is I'm a cancer survivor. So 9 years removed. Thank you. Had 4 months of chemo and 3 weeks of radiation, and have been through that. I think it's helped me a ton with being able to empathize and sympathize with certain individuals in my demographic, and it's just when I was going through that 9 years ago, right? I had been in Medicare for about a year and a half or so. I had developed a number of key relationships with organizations and clients and different things. And when that happened, it was like everyone had my back, and it was a really cool experience to have. It felt like family, and so that's part of the reason why I love doing what I do is you're able to serve in such a way where they feel like family, and that's been a pretty cool ride thus far. So.
I love it. Well, yeah, we believe, which is why we try to do a good job here, that an educated caregiver is a happy caregiver. So our goal is to find the pros like you, bring them in here, ask them all the questions that we know or that we're asked to ask you guys, so that we can educate those who are just trying to navigate this, take the very best care that they can of mom or dad, or of themselves. And so we are grateful that you were here, giving us all the information about Medicare, Medicaid, and all these things. I want to give you a second to tell people how to get a hold of you, but first, I want them to get to know you. And typically we do this at the beginning. Today's just been one of those days. So we're going to start at the end. Tell us just a little bit about you, your family, like who you are, so that when people reach out, they know a little bit more about you and who they're talking to.
Sure. So I've been married it'll be 15 years in June of next year. So 4 kids. I always like to make the comment, I promise I'm not 17. My wife requires that I have facial hair at all times, because if I don't, it gets scary. Okay.
You still at 12?
Yes. And so some weird eyebrows are right now. My wife looks extremely young as well. But anyway, 4 kids. So I've got a 16-year-old daughter, 13-year-old daughter. She'll be 13 next week, 9-year-old son, and a 3-year-old daughter. She'll be 3 in a couple months. So
Nice.
big family, definitely a family guy. Love coaching, whenever I can, being very involved in their lives. But with something unique about me, I would say for our listeners is with the 10 years of experience that I have working for 2 large corporations, one from the sales side and one from the managerial side, and then 3 years on my own representing all the different carriers, is kind of the perfect scenario, I would say, for a broker. I'm really appreciative of my time spent at those different, the 7 years prior to starting my own company. And it's really helped me with navigating, the ins and outs of Medicare. Something else I would say to every listener out there is a simple 2-minute phone call is all I would ask from every person listening, because in 2 minutes I can share with you a number of different things. I can then meet with you in person if that's what you want, or we can do a Zoom or whatever we want to do, meet in person. But and I'll spend as much time as needed. It'll start with a 2-minute phone call. And if you're happy with what you have, maybe you just want to know what your plan of changes are going to be from this year to next. You're never going to get the pushy, salesman type of personality in me. That's just not who I am. I'm an educator. And we want to educate our listeners about the different options. And I'll be the first to tell you, if you're already in the perfect plan for you, that's all you're going to get from me as a confirmation.
Yeah, I love that.
Which is great.
Yeah, well, we say, the goal of the podcast, obviously we want to educate people.
Right.
But with the goal to help save them money,
Sure.
headache, heartache, whatever we can, simply because they're already dealing with so much. Like you, or, like I said, my mom will be coming up on this age soon. I have 5 kids. I'm a busy professional. We coach, we're always busy. And when life changes and you have to take care of mom and dad now, or you get to, that's an extra responsibility. And it's not like there's a class or a course or any preparation for what that looks like to navigate. So we decided, well, what if we just tried to help knock down some of these big topics like Medicare? And you've made it less scary for us today. But the goal is, connect with Preston. If you have questions about Medicare or Medicaid or any insurance questions, we're grateful that you were here. And we just wanted to provide a resource to have a great conversation, but then reach out to you. So it sounds like one-on-one meetings, either over the phone or Zoom, couple minutes.
I usually come out
and you can help out. You make house calls as well.
I actually come out to the home for the majority of the meetings that I have. So there are some out there that aren't as comfortable. Maybe they don't want to. Maybe they're just dealing with a lot in the home, and so you can meet in a public setting close by. But I usually make house calls, which makes it very convenient for them.
Oh, that's awesome. Thanks for being here. That's another episode of the Happy Caregiver Podcast.
And I'd like to remind our listeners, don't forget to subscribe to the Happy Caregiver Podcast. Share this episode with someone who needs it, and stay tuned in for more insights and stories. Thanks for listening.
Can I interject one more thing?
Yeah, of course.
Contact information. So my phone number, 801-857-4691. Email is phenry, so PHENRIE, number 6 @gmail.com. Reach out to me. I'd love to be a resource.
Amazing. Yeah, we'll put all of this with your episode down below so also we can find it.
Perfect.
Yeah.